Hello, CrabCon 2025. My name is Noah Goldfarb. I'm a fourth year veterinary student, and I'm here to talk to you all today about the role of a veterinarian in hermit crab health and disease. My presentation today has been done in collaboration with Dr. Carlos Savage, a board-certified fish veterinarian with a PhD in aquatic animal medicine. Just a little bit about me. I'm in my final year at the Virginia Maryland College of Veterinary Medicine, located on the Virginia Tech campus, with plans to pursue a career in avian and exotic pet practice. I've been a lifelong hermit crab enthusiast, as pictured, and my journey towards becoming a veterinarian began with keeping hermit crabs and developing a passion for educating people on their proper care. I imagine you may have seen the title of this presentation and thought to yourself, who and why would anyone bring a hermit crab to the vet? Well, the objective of this presentation isn't to convince you that you need to start taking your hermit crab for annual checkups, but rather highlight some of the advances in veterinary medicine for invertebrate care and discuss what a veterinarian could do for a hermit crab and their owner in terms of diagnostics and treatments when an issue arises. Just a little disclaimer, this presentation is not all exhaustive, but rather a 20-minute brief highlight of some of these advances. To start off, I thought I'd pose the question, can hermit crabs even get sick? To begin answering this question, I wanted to outline some diseases that have been reported in the literature on hermit crabs. In marine hermit crabs in the genus Pagurus, a fatal fungal pathogen has been documented affecting the gills and brachial joints. Regarding internal parasites, a study on nematode infections in Red Sea land hermit crabs found a link between higher parasite burdens and decreased fertility. A variety of internal parasites from multiple classes have also been reported in marine hermit crab species, with varying trophic strategies, life cycles, and tissue tropism. Additionally, several external cohabitants have been identified in hermit crabs, including 11 species of mites found on various Sonobita species, though the true symbiotic role of these mites has not been fully determined. However, as I'm sure many of you know, scientific research on land hermit crabs is lacking when compared to other animal species, especially in regards to disease. When I went searching through forums and online posts, I found numerous accounts of hermit crabs with a variety of clinical signs, including lethargy, diarrhea, exoskeleton discoloration, and mass colony die-offs, and even a report of parasites observed eating through the exoskeleton of a live crab from the inside out. In other decapod crustaceans used in aquaculture, a long list of pathogens have been described with lots of overlap as shown here on this slide. All of this to say, in response to my initial question, hermit crabs may indeed be affected by more pathogens than those described in scientific literature and exhibit signs of clinical disease. Now that we've established hermit crabs may indeed suffer from disease, let's dive into some signs that can indicate it might be time to visit a veterinarian. Much like you would take your dog to the vet, hermit crabs also require attention for specific health concerns. These include, but are not limited to, injuries, unexpected deaths or mass colony die-offs, shell rot, a term used often in forums and blogs which we'll explore later, abnormal feces, mites, anorexia, or unusual behaviors. A visit to the vet may also include consulting for proper husbandry advice and electing for humane euthanasia when necessary. What would a vet visit for your hermit crab even look like? Surprisingly, the process for an invertebrate patient is quite similar to what you'd expect for a dog or cat, with a few adjustments. The veterinarian will begin by gathering a detailed history of why you brought your hermit crab in, followed by a physical examination. Based on their findings, they may recommend diagnostic tests to identify or rule out any causes of disease, which can help guide treatment options. Finally, using the results of the exam and any diagnostics, your veterinarian will outline a plan to help get your hermit crab back on the path to recovery. A key concept commonly used in the veterinary care of non-traditional species is comparative medicine, the application of medical principles from one species to another, especially amongst taxonomically similar groups. For land hermit crabs, this involves leveraging research on closely related species of greater economic importance, such as true crabs, shrimp, and lobsters used in aquaculture, as well as other invertebrates more commonly kept and studied in veterinary medicine, such as arachnids. In many of the following slides, we'll discuss some of the advances and studies in veterinary medicine in these species and how they may be applied to hermit crab patients. To begin, diagnostic tests play a crucial role in understanding what's going on with your pet, and hermit crabs are no exception. Although the range of diagnostics available for hermit crabs is more limited compared to dogs and cats, there are still several tests that may provide valuable insights into their health and reveal underlying pathological issues. The options we'll discuss today include fecal exams, microbiological testing, parasite identification, and necropsy. Considering reports of nematodes in the Red Sea land hermit crab, as well as accounts of flukes and other internal parasites in marine hermit crabs from scientific literature, along with anecdotal reports on forms of land hermit crabs experiencing diarrhea, fecal examination could be a valuable diagnostic tool. By analyzing feces, we can identify parasite eggs or larvae that may be causing diarrhea or other abnormal fecal presentations. For hermit crabs, which produce a small amount of feces, a direct fecal smear or wet mound is particularly useful. This involves taking a swab of feces, fixing it onto a slide, and examining it under a microscope. The image below shows a fecal smear from a dog with several parasite eggs circled in red as an example. Tests like these can guide veterinarians in selecting appropriate treatments or medications to target the pathogens responsible for illness. Identifying external parasites is another essential diagnostic tool. It helps determine whether the parasites are pathogenic, understand their life cycle, and assess the risk they may pose to a crab colony. This allows veterinarians to recommend appropriate treatments and prevention strategies. Microbiological tests are designed to detect microorganisms that could potentially cause disease. For example, if a dog visits the vet with itchy, inflamed ears, the veterinarian might take a swab and examine it under a microscope to identify the pathogens responsible for the irritation. Identifying organisms and their characteristics is a fundamental principle in medicine, helping guide appropriate treatments. For hermit crab patients, various laboratories accept invertebrate samples, including swabs, tissues, or fluids, for analysis to identify bacterial, viral, parasitic, and fungal microorganisms that may contribute to disease. However, unless sampling from a sterile site, contamination with the animal's normal flora is inevitable. In traditional veterinary species, these microbial populations are well documented, but for hermit crabs, there is limited data on the flora that naturally colonize them. One study explored the use of probiotics in hermit crabs, and as part of this research, identified the normal flora on the carapace and inner shell surface of hermit crabs. Although the study did not quantify the expected levels of each bacterial species, it provided a list of bacterial species found on purple pincher hermit crabs at that site. One area where microbiological testing could be especially helpful is in diagnosing shell rot. Many online forum and blog accounts describe exoskeleton discoloration and ulceration as shell rot. However, no formal publications definitively identify the causative agents of shell rot in hermit crabs. In other decapod crustaceans, shell rot is a symptom caused by a range of pathogens including bacterial, viral, and fungal agents, each requiring different treatments. Hemolymph is the invertebrate equivalent of blood, containing hemocytes that carry oxygen, salts, plasma, nutrients, and ions. Hemolymph analysis can be used as an important diagnostic tool in the veterinary care of invertebrates. Hemolymph can be drawn from a live patient and examined under a microscope for the presence of pathogens or sent off for culture in a lab. In the top right left image, a sample taken from an Indian prawn is shown. Those small purple spheres are yeast, which is indicative of a fungal infection in this animal. Some standardized values for hemolymph in hermit crabs exist, such as the amount of total protein in purple pincher hermit crabs, acid-base balance, and normal osmolality in several Soanobita species. In a study investigating the effects of osmoregulation in hermit crabs, hemolymph samples were drawn using a 22-gauge needle and purple pincher hermit crabs at the base of the larger claw where it meets the body. The last diagnostic technique I wanted to discuss today is necropsy. Necropsy is the process of examining an animal post-mortem to determine the cause of death. For pets like hermit crabs, which are often kept in groups, necropsy can be an important tool for investigating unexpected deaths, especially if there is a concern that other crabs in the colony may be affected by a similar cause. Necropsies can help identify not only pathogens, but also toxin exposure, physiological changes secondary to poor husbandry, and even changes resulting from nutritional deficiencies. For example, in shrimp, vitamin C deficiencies have been identified post-mortem as dark lesions in the gastrointestinal tract and subcuticular tissues. In lobsters, molt death syndrome, a fatal condition, is linked to a deficiency in a fat molecule called phosphatidylcholine and has been observed post-mortem as abnormal calcium deposits on the inner exoskeleton. In fish, chronic exposure to chlorine can lead to gill hyperplasia, or thickening of the gills, which can be seen histologically post-mortem. These findings are crucial as they can provide owners with treatments and management recommendations to help prevent similar conditions from affecting their other crabs. Now that we've discussed how we may determine the cause of disease in hermit crabs, I wanted to take some time to discuss some of the potential treatment options that have been used in hermit crabs and other similar invertebrate patients that may be useful in helping your hermit crab get back to optimal health. These options include antiparasitics, antifungals, antibiotics, supportive care, wound management, and humane euthanasia. I do want to give a brief disclaimer that the treatment options discussed in this presentation are for informational purposes only and to highlight the potential options for hermit crab patients. This information should not be used as a substitute for professional veterinary advice. Please always consult a qualified veterinarian before making any medical decisions for your pet. As discussed, various parasitic pathogens have been observed in hermit crabs. While effective at-home treatments exist, including the use of predatory mites, 2 treatments for ectoparasites that have been validated in shrimp may also be useful for hermit crabs if at-home remedies fail. These treatments include very dilute formalin and potassium permanganate immersion. Additionally, manual removal under sedation is commonly used in tarantulas. However, because hermit crabs inhabit a gastropod shell, parasite removal may be challenging, especially if the parasites are colonizing the crab's abdominal region. For endoparasites, such as the nematode described in Red Sea land hermit crabs, fenbendazole, a medication commonly used in canine and feline patients, has been reported as safe and effective in tarantulas. While fungal pathogens have only been described in marine hermit crabs, the same species isolated are known to infect a variety of other invertebrate and vertebrate animals. Several options for antifungal therapies have been proven safe and efficacious in other invertebrates. Now, hermit crabs, as you all likely know, frequently groom themselves, so extra precaution would have to be taken following the application of any topical medications. A variety of antibiotic options exist for crustacean patients that cover a broad spectrum of bacteria and are available in a variety of formulations. Because Soanobita species rely on gut microbes for the digestion of feedstuff, it's important that any antibiotics used in land hermit crabs do not disrupt this balance. Analgesia, or pain management, is crucial for all animals, including invertebrates, when undergoing a potentially painful or noxious procedure such as wound repair. Several analgesics have been studied in invertebrates, including lidocaine and xylazine in land hermit crabs. Additionally, various sedatives have been used in hermit crabs and other crustaceans. Due to their shy nature and protective gastropod shells, the administration of anesthetics, such as inhaled or gas anesthetics, may be useful in providing light sedation, allowing a veterinarian to perform a thorough physical exam. Anesthetic monitoring can be achieved using an ultrasound Doppler device placed on the carapace of the hermit crab to monitor heart rate, as demonstrated in this blue crab on the bottom left. Supportive care plays a crucial role in recovery. Similar to humans and other animals, fluid therapy can be administered to hermit crabs to address hemolymph loss or severe dehydration. This can be done either enterally or through the injection into the brachial joint space. Additionally, we have data on the blood osmolality of several Soanobita species, which helps guide us in selecting the most appropriate fluid to quickly correct any deficits. As mentioned, various pain management options are available, and several brands of emergency nutritional support formulations commonly used in exotic pet practices could further aid in the recovery of a debilitated crab. A 2015 study investigating the microflora contents of strawberry and ruggy hermit crab hindguts hypothesized that post-purchase syndrome deaths were linked to a decrease in hindgut microflora populations. Hermit crabs, being omnivorous detritivores, rely on these microbes for the breakdown and digestion of food. The study observed that hermit crabs taken from the wild and placed immediately into captivity, even under optimal conditions, died inexplicably. These deceased crabs exhibited significantly reduced hindgut flora populations compared to thriving crabs, with stress being proposed as a contributing factor to the die-off of these microbes. As no hermit crab-specific probiotics are currently available, prebiotics may offer a way to support diminished hindgut flora. A related study on prebiotic use in mud crabs found that galacto-oligosaccharides and resistant starches stimulated the proliferation of short-chain fatty acids, which is the end product of microbial digestion in these crabs. An injury to the exoskeleton can pose a serious threat to an invertebrate, often requiring veterinary care. Treatments may involve removing dead tissue and sources of infection, controlling bleeding, and even repairing tissues to create a temporary exoskeleton that can protect the soft underlying structures. This video from the Aquarium of the Pacific shows a team of veterinarians repairing a leg injury on a king crab.
This crab is under construction. Okay, let me explain. Unique problems require creative solutions, and that is exactly what Aquarius Brooke and our vet staff are working on today. This crab's shell was wearing down and showing signs of infection, and these problem areas weren't being replaced by natural molting. So, Brooke and the vet team have developed prosthetics to replace pieces of the animal's exoskeleton, and they look amazing. To do this, they anesthetize the animal and remove the compromised pieces. Then the team creates and secures the prosthetic pieces to protect the crab's soft underbody. Once dry and secure, Brooke blends the prosthetic in with the rest of the shell using non-toxic paint. After some dry time, the crab is ready to head home.
Unfortunately, there may come a time where medical intervention is no longer effective or is not an option for the owner. In such cases, humane euthanasia, which translates to good death, may be the most appropriate course of action to alleviate suffering. The American Veterinary Medical Association's 2020 guidelines describes a two-step method for terrestrial and vertebrate euthanasia. The first step involves the use of a primary method in which the animal is induced under general anesthesia. Once under anesthesia, an injection of a barbiturate, such as phenobarbital, is administered into the coelom, which is analogous to the abdominal cavity in mammals. Death can be confirmed via ultrasound Doppler monitoring of the carapace as demonstrated on the previous slide. It's recommended that this be followed by a secondary measure to ensure total death, such as ethanol immersion, pithing, or freezing. Methods such as physical force, potassium chloride, or chilling and freezing are considered inhumane primary forms of euthanasia and should never be used as a sole method. Client education is a significant aspect of a companion animal veterinarian's role. Proper husbandry, especially for exotic pets, is crucial in preventing illness, supporting recovery, and reducing mortality. As many of you know, proper hermit crab care is often overlooked by those who purchase them. Given the abundance of online resources, it's unlikely that someone would visit a veterinarian solely to learn about hermit crab husbandry. However, discussing and ensuring proper care remains an essential part of any veterinary appointment. Veterinarians can also assist in developing a biosecurity plan during disease outbreaks to prevent further spread of disease within a colony. Additionally, your veterinarian can inform you about any potential zoonotic risks associated with hermit crabs. While many online care guides claim that hermit crabs pose no disease risk to humans, this is not entirely accurate. For example, hermit crabs in Puerto Rico that feed on monkey feces have been found to transmit parasite eggs, which can occasionally cause disease in humans if ingested. Furthermore, several organisms cultured from the exoskeletons of purple pincher hermit crabs have been found to have zoonotic potential. While the risk is low, it's important to be informed about any zoonotic threats your pets may pose, especially if you have children or immunocompromised individuals in your home. Exotic pet medicine, particularly in vertebrate care, still lags behind the advancements made in veterinary care for traditional domestic animals. Hermit crabs present unique challenges that further complicate their medical management. While this list is not exhaustive, some of the most significant limitations include the inability to safely remove a hermit crab from their shell, which restricts a full-body examination. Shy crabs may retreat deeper into their shells, making assessment even more difficult. Another challenge is obtaining an accurate weight for dosage calculations, as the shell itself adds extra weight. One possible solution is for the owner to bring an identical empty shell, allowing the veterinarian to subtract the weight difference. Additionally, no studies have been conducted on the safety or efficacy of antimicrobials in hermit crabs, so all data must be extrapolated from other crustaceans or invertebrates. While hemolymph can be connected for some analysis, standardized reference values for hemolymph chemistry or complete cell counts, such as those available for other invertebrates like tarantula, are lacking. For very small crabs, administering injectable medications is particularly challenging, and their tiny fecal output makes it even more difficult to identify internal parasites compared to animals that produce large amounts of feces. Hermit crabs can't be force-fed medications like some animals, so oral drug formulations must be readily accepted. Because hermit crabs frequently groom themselves, it's important that all topical therapies are either safe orally or be removed following application. Lastly, a molting hermit crab can't be safely transported or examined. I imagine that for many of you, the veterinarians who care for your dogs and cats likely do not see hermit crab patients, or at least don't advertise so. However, there are a few ways you may be able to find a veterinarian nearby who can treat your crabs. The World Aquatic Veterinary Medical Association website provides a list of certified aquatic veterinarians with expertise in aquatic animal medicine, including invertebrates. Veterinarians who treat other exotic pets may be able to care for your crabs as well. Additionally, the UK-based Veterinary Invertebrate Society consists of veterinarians who do see invertebrate patients. That concludes my presentation for today. I hope you now have a better understanding of the veterinary care available for hermit crab patients. If I'm not here in person today, feel free to reach out via email using the contact information below. Thank you all so much for listening.
Yeah, it depends on the compound. So, I mean, there's different insecticides that are used for mosquitoes. One thing commonly used is mosquito bits that contain a biologic agent that targets the larval stage of mosquitoes. I'm not sure, where you live, what compound is used. Yeah, the mosquito bits, they come in little packs of the mosquito. They're still corn husks with biological agent bacteria. I've used them with like millipedes and land snails, with no issues because they are pretty specific to larval insects. I use them to target fungus gnats and all my enclosures. And if you guys have issues with fungus gnats, they work really well. So yeah, largely speaking, a lot of those insecticides that are not just biological agents that target um, invertebrates of any kind. There's many different classes of insecticides that could potentially harm hermit crabs, but it's really specific to the product that's being used. But I can't answer specifics beyond that.
Yeah, kind of a quick follow-up on that. So where they do spray in the Florida Keys by crustacean sanitation and management, they are a larva species, right? So in theory, it could impact the population.
Yeah, you're asking specifically about the biologic agent and that's just the mosquito bit. It's pretty specific to the larval form of mosquitoes, which is different from a larval hermit crab. Yeah.
Like heat would be harmful to any hermit crab.
I believe so, but I have to double check. I'm not like knowledgeable on insecticides. Sorry. Alright, so that. Yeah.
Is there any prebiotics or probiotics available that we could use? I did rescue and get in lots of diagrams and it was saying that the biome.
Yeah. So probiotics, probiotics is a little bit controversial, right? Because they make these products that are pretty general, but each individual animal has pretty specific microbiome. And some of these products that say they treat multiple dog species may not be actually representative of Western animals. I guess the probiotics are a little more tricky. But prebiotics, like I mentioned, they kind of just get substrate for those microbes to grow and flourish. They're not really replacing the microbes, right? Which is what a probiotic is. Probiotics full of all those little microbes, and in theory, will replace the microbes that are in that animal's gut. So if you don't know, there's one study, right? But we can't buy a bottle of those 400 bacteria that was in strawberry hermit crab's gut and a bottle and sprinkle it on their food. But with prebiotics, you potentially get substrates for those bacteria that will allow them to flourish. So the one study done in mud crabs used galactolactosaccharides and different types of roots and starches, and they did see proliferation of the end product of this microbial digestion, which authors included indicated that it was successful in helping those bacterial flourish. You could potentially try resistant starches. I was kind of threw it off with the presentation. There's no formal publication on hermit crab specific use. I don't think read on any like the HCA forums or some of the other hermit crab forums people trying them. But I thought it was something that I read and I threw it in there if anyone wanted to try.
Is it something that's commercially available?
Yeah, people use it. It's dietary supplements with those resistant starches. You saw that at some of the nutrition stores. So they were available on Amazon. I did look. But I would proceed, under board for them caution. But you can read the study. It is linked in my presentation. You want to read a little bit about how they did it, what they used for their mud crab. But it isn't things it's just a common dietary supplement.
Thank you. I missed the part about the gnats, what you used for the gnats.
Oh yeah, so I use fungus. So I have a bunch of millipedes. That's like my big invertebrate hobby in addition to the hermit crab. So I get topsoil from Home Depot and I get seeds from So I use mosquito bits. They're biologic agents that are, bacteria are pretty specific to targeting the larval stage of mosquitoes that are infecting our class. But you just mix it with water and pour it in the substrate after you pretty sharp decline from that. But it comes in like a red bag, and there's just a bunch of dried corn bits. And then once they're activated with water, the bacteria are able to use the environment. Yeah.
I'm a veterinarian also.
Oh, awesome. You want to come up and join?
No,
okay.
Maybe in the future, but, so you just recently got some flu and all other potential parasites that are present. I don't know how far along you have gone into it, but, have you found that they can harm the hermit crab potentially, or?
So I found these rotary eggs, which are really common in most invertebrates. In terms of, you call it like DT syndrome, so this is an aquaculture term, right? So these terms that are kept in really high capacities, being farmed to the first of foods, so these stressors of being farmed like that, and that allows for overgrowth of what's probably normal floral inhabitants. I haven't found anything that seems pathogenic or potentially parasite-wise, but I still thought it was neat that consuming parasite foods, there's no anything that wasn't there, but the air greens are pretty common in these most invertebrates. Yeah.
You were doing the, look at the microfauna, were you doing that genomically at all, or was it just microscopically?
I would like to do genomically. It costs a good bit of money to run it genomically, so I reached out to Mary. I'm currently working on the genomic sequencing parasites with fish at the moment. With Dr. Smith in the class. So I had a microscope available to me. I reached out to Mary to see if I could just look at some hermit crab food really consciously, put some merit to the diagnostic method that I found. So I started doing a direct fecal pyramid to identify some parasites. It'd be great if I could get a little bit of funding and put it through the molecular sequencer. Not allowed me equipment, but I just need to apply for a grant to actually do that sequencing, which would tell me exactly what species of Veterinarian was in this daily parasite segment. Since there are some years like a pretty crude method of parasite identification, there's probably more that it didn't see. But it was promising so that I called on things.
Yeah, it might be interesting also to swab expel and inside the shell and see what's the microbiome.
Yeah, I would.
There and healthy and unhealthy crabs.
Yeah, it'd be really cool to also do some like necropsy stuff with them too, especially get specimens and some of that sequencing. It's surprising that there's so little research done on hermit crab health in general. I mean, in addition to you all who are very serious hobbyists and really value your pet, right? There's so many kids who buy hermit crabs at the beach each year who knows what potentially zoonotic pathogens these animals have that are pulled right from the Caribbean, and the kids are touching and washing their hands. So I think it'd be really interesting to get active in that, and also explore what potential zoonosis hermit crabs have, because right, if you find that there's something potentially harmful, that could help slow down the sale of hermit crabs in those beach stores, which is kind of what initially prompted me to look at those parasites. Maybe I thought I'd find something with potential zoonosis.
Yeah, if you do get to the point where you're doing a lot more, we can take some captive bred babies and make sure they never come in contact with wild crabs and see if they have parasites, which would be from the things they're being fed instead of inter-animal transmission.
Yeah, that would be super interesting, yeah. And you guys would be the only group of captive bred hermit crabs that are isolated from wild colonies, so yeah, definitely interesting how to explore. Yeah.
Need to go further and figure out like geographically, like because people from different geographical locations are force feeding their crops.
Yeah.
Whether that's introduced something to their diet too.
Yeah, it'd be really interesting.
Well, I do from time. I just looked at amazing like how many ways to take the interest in it. Because we
Thank you very much. I appreciate it. So hermit crabs actually kind of got me interested in it in general. I got to eat from it as well, probably similar to a lot of you guys and your kids. And at that age, I got really interested in hermit crab care and really how mistreated they were, and I got really passionate about educating people online about proper hermit crab care. It kind of led me to veterinary technology tests and teaching people how to properly care for them and provide you their best treatment. Yeah, I have a lot of time for the millipede. I have 2 hermit crabs now, but yeah, the millipede. I don't remember the hermit crabs.
I have a question from online for you.
Yeah.
You mentioned hermit crabs being a risk for immunocompromised individuals. Can you elaborate on that and explain?
Yeah, oh, sorry, I get this kind of aspect here. Yeah, there was one study, I think Fluker's made the product, pretty sure Fluker's was the brand, this is a probiotic for hermit crabs. And there's one study done seeing if this like, it was like a topical probiotic, it wasn't enteral or oral probiotic. I don't know if you guys have seen this like probiotic hermit crab case by Fluker's. There's one study that wants to evaluate what's actually in the product being marketed, they don't really advertise on the product. And as part of that study, it did look at, before they gave it what was the normal flora living on the surface of the hermit crab, and that's like that top surface of that hermit crab right behind its eyes, and on that top inner shell of the hermit crab. They did find several bacteria that are potentially zoonotic to immunocompromised individuals. You really have to get a large amount of that bacteria. Really get sick. They're not highly virulent pathogens from my understanding from what I read on them, but they do have zoonotic potential, and those ones that I listed on the slide, there have been reports caused by those pathogens in people, and hopefully they were from hermit crab spread, right, to be really specific. But some of those organisms reported were found across the teeth of hermit crabs, and then there's one report of them in Puerto Rico, and I don't believe the hermit crabs that we keep in the U.S. are wild caught in Puerto Rico. I think they must have come from Haiti, right, if that's correct. But in Puerto Rico, they found that hermit crabs eating the monkey feces were intermediate hosts for the parasite, which means they're kind of like between where the animal passes the parasite in a feces and the next animal takes it up. So the animal either eats hermit crab to get sick, or the hermit crab passes its poop to the next animal who could become sick. So this parasite of monkeys in Puerto Rico is found to have, hermit crabs are found to have a role in that life cycle, and there have been reports of that in humans. That was pretty specific to that geographic location with those monkeys. That's really that parasite.
I really wondered about that a lot. We do have a lot of people in the hermit crab community who have multiple autoimmune diseases, and do those people are they just more likely to gravitate towards hermits, or is keeping our hermits somehow, leading to that? That would be a really interesting study.
We're getting feedback that the microphone in here is perfect, so if you stand right here and project to their room, because they said they heard me perfectly clear. So you just got to speak loud for them, and let's see if we can get some better audio.
That was just an observation, not really a question, but something that's been on my mind. I think Caroline Owens, who had Jonathan for 45 years, has Luca. I mean, she has just a multiple host. And is that happening because of our herb? We don't know, right?
My understanding is that the organisms aren't causing people to become immunocompromised. It's just that if someone is immunocompromised and exposed to these organisms that are naturally inhabiting hermit crabs, there's potential for disease. But same could go for dogs and cats, right? A lot of the normal flora on them could also become potentially harmful to a person if they were immunocompromised. So just good to practice proper biosecurity with your hermit crabs, right? And if someone was to bring their hermit crab to the vet with young children, or it came up in the history, right, that someone in their family was immunocompromised, it would be, the role of the veterinarian to inform them of that potential risks and how to properly wash hands, how to properly clean equipment, separate things from where they're cleaning, your own dishes and food and such. So that's why I threw it in there mostly. Any other questions? Oh, yeah?
I just only wanted to say from my personal experience, I was starting to put all my stuff before I had good.
All right. Well,
I just want to say kudos to the young lady with the red hair. She's incredible.
Thank goodness.
Her running around.
That's right. Thank you, Robin. Thank you, Noah. That was amazing.
I'm glad you guys enjoyed it. Thank you all online.
Thank you.
Sorry, I didn't handle you like that. Okay.